Well, ladies and gentlemen, good morning. And I am just going to make some introductions here and then turn it over to the Minister. And I'll be back to talk about the good news that she's bringing to us this morning, that we're bringing here together in partnership. And I think that's very important. But I want to just introduce, first of all, the people who are part of this group this morning and who will be saying a few words. Starting with our Minister of Health for Canada, the Honourable Patty Hajdu, followed by Dr. Eileen de Villa, our Medical Officer of Health, of course, Councillor Joe Cressy, who is the Chair of the Board of Health, and all of these people, I will just say to the public, have been working very hard on something that's been under discussion for weeks, and it is a very, very important initiative. I think it's going to help a lot of people, and I want to just commend and thank them all for what they have done to make this a reality today. And I also want to acknowledge the help and support we've had on this and many other matters from the members of Parliament from Toronto. And today there are 3 of them here represented, unless any have arrived behind me while I've been talking, and they are Jamie Maloney, MP, Adam Vaughan, MP, and Han Dong, MP. And these are 3 people I can assure you who are constantly advocating for the best interests of the people of the City of Toronto and beyond. But they're MPs from Toronto, and I want to acknowledge their help on this and many other matters that help put our interests forward. And so on that note, I will call on the Minister, who herself, again, going all the way back to the beginning of the pandemic. I remember us standing in a restaurant over on Spadina talking about measures that we were going to begin to undertake together at that time to protect and to look after the people of the City of Toronto and all the people of Canada. And I think she's been doing a very steadfast job in that regard, and I thank her for that and call upon her to make this morning's announcement.
Thank you very much, Mayor. It's such an honor to be here with you all on the traditional territory of the Ojibwe, the Anishinaabe, and the Mississaugas of New Credit. And I, in particular, am thrilled to be joined by Dr. de Villa, who, with a person with a public health background, never underestimate the power of a medical officer of health. They are truly leaders in our community. Of course, my colleagues. Thank you so much for being here. It's nice to see my colleagues in real life. You know, we've done a lot of Zooming, but nothing beats face to face. And of course, Councillor Cressy, who is a passionate advocate for the citizens of Toronto, and I've had the pleasure. I just found out of working with his mother years ago when I was on the CAMH Advisory Council. So today, obviously, here to make an announcement with the City of Toronto. You know, as the Mayor mentioned, that we've been working at the federal level with partners all across the country, at the provincial, the territorial, and indeed at the local level. And the goal has been one goal, which is to keep Canadians safe no matter where they live. And I think it's this Team Canada approach that's been noticed actually around the world, that despite any partisan differences that we might have, you know, of course, there's many different kinds of perspectives across the country on many different issues. One thing has been true in Canada for COVID-19, that we've all really put our shoulders to the grindstone and worked together, put aside differences that we might have politically with one solid goal in mind, and that's to protect the health and safety of Canadians. And in fact, Canadians have joined us in that effort and have made tremendous sacrifices over the last several months, personal sacrifices, too many to name, but of course you've all heard the themes, whether it's employment, whether it's sacrifices around seeing family, personal sacrifices around work and others. We know that Canadians have been working really, really hard to contain the virus and slow the spread of the virus in Canada, but we can't let our guard down. And as people gradually return to workplaces, as we see schools open, we do expect to see resurgences in cases, and it's important that as we learn to live with COVID-19, that we don't let those resurgences get out of control, and that we do everything in our power to reduce infection and spread across our communities, because that's what's going to protect our families and our communities at large. And that's why we've been focused on encouraging everyone to continue with the public health measures that hopefully by now are familiar to all of us, to wash our hands, to reduce our gathering sizes, to stay in our bubbles, to make sure that We are doing everything possible, even when it's hard, to reduce spread, including staying home when we're sick, and that if we do get sick with COVID-19, that we stay apart from others. Really critically important. And we know that that's not easy for everyone. We know that depending on people's situations, they may be living in congregate settings with roommates in crowded housing conditions. Financial costs can make it impossible or unsafe to effectively self-isolate. And when this happens, of course, this increases the risk of spreading COVID-19 to other people within the household. In fact, we've seen this worldwide, that one of the greatest risks is the spread within household members. And that's why today we're confirming $13.9 million in funding for Toronto Public Health to operate a voluntary self-isolation centre. Now, together, we can reduce the spread of this virus in Canada's most densely populated city. The 140 rooms of the voluntary isolation centre will provide a safe place for people who have been diagnosed with COVID-19 and don't have an ability to self-isolate. Think about people that have to share bedrooms or share washrooms or share kitchen facilities. It can be incredibly challenging to stay separate from household members when you're sick with COVID-19. And we've heard heartbreaking stories of people knowing that they are ill and knowing that they don't have the capacity to stop the spread within their own home. So this space will be available for people who live in housing that lacks the necessary space to allow for that proper distancing, and this will help to contribute a reduction in spread of the virus among people who would otherwise be sharing that space. And of course, in turn, it reduces the spread in the community at large. So I'm thrilled to be able to be here with the City of Toronto. We started talking about this months ago, and I'm really glad to hear that we're moving forward with this. Of course, this service will be available to other cities as well. Because at the federal government, we really believe that all hands on deck is what's required at this point in time to reduce the spread of COVID-19 and protect the health of Canadians. Thank you very much.
Minister, first of all, may I say thank you, and may I say on behalf of the people of the City of Toronto, and we'll hear as well from Dr. de Villa and Councillor Cressy, that this is an announcement from our federal government that is welcome and it is necessary. Because I think we've seen very clearly, and it's been thanks to the transparency that has been aided and assisted by Dr. de Villa and her team, that COVID-19 can impact anyone in this city. And it has shown not too many signs of slowing down. We're seeing a bit of a resurgence that we have to attend to, and how we handle the spread even going forward will really help us to measure and achieve greater progress. And a big part of our efforts in reducing the spread is through our focus on proper self-isolation. We know that there are many homes in the City of Toronto, not just in densely populated areas, but in multi-generational families and so on, where self-isolating, as the Minister said, is something that is very difficult to achieve, if not impossible, and that is going to contribute to the spread of the virus. Data has shown us that lower income neighborhoods were disproportionately affected in the early stages and today by COVID-19, in part because individuals living in these communities, once they tested positive, may then have experienced difficulty in being able to properly isolate themselves. And so that is why discussions began some time ago. And I want to acknowledge here today some of the very early discussions, as Dr. de Villa and the Minister would know, were with the Deputy Prime Minister, Chrystia Freeland, who has also extended her support to this initiative, which has been successfully deployed in other cities and other parts of the world. And I think it's just another example of evidence that the city, working in partnership as we have done with the Government of Canada and with the Government of Ontario, is doing everything that it can to make sure that we stop the spread of this virus. So I want to thank the federal government and Minister Hajdu for today's announcement. I want to thank the Deputy Prime Minister for her assistance in this all the way along, as well as the members of Parliament from the City of Toronto. And I want to thank Dr. de Villa and Joe Cressy, Councillor Joe Cressy, for their leadership here at Toronto in going through the complex task of actually making this happen and putting the agreements in place. And finally, I want to say thank you in advance to the people who will use this. We've emphasized the fact that it's voluntary, and not everybody would, even when they're ill and even when they want to care for their loved ones, would volunteer to move away from home for a period of time and live somewhere else. But I think there are going to be a lot of people who will use it because they are considerate of their own family and of their neighbors and of their fellow citizens, and I want to say thank you to them for their cooperation. We've seen a lot of that. I was on the subway this morning and saw, literally, I was looking hard to see if I could find somebody who was not wearing a face covering, and I couldn't. And I know there probably was somebody on the train somewhere, but I just think the kind of compliance we're seeing with these things is very heartening indeed. May I now call upon our Medical Officer of Health, who has just been a rock. I would describe her as a rock star, and she's probably that too. But she's been a rock in terms of providing us with steady, professional advice and all the way through this. And I've said proudly that as mayor, I haven't had to have one occasion on which I have expressed disagreement. I've asked lots of questions of her, probably so many that it frustrates her, but she's just been great in helping us to handle this, as she will going forward, and as she will be with this particular facility. So Dr. de Villa, over to you.
Well, thank you, Mayor Tory, and thank you, Minister Hajdu, for joining us here today. I want to express my sincere appreciation to our federal government partners, including the Public Health Agency of Canada, for their generous support in making this new COVID-19 isolation site a reality for our city. When someone is infected with COVID-19, we know the best way to prevent further spread is for them to stay home and self-isolate. Unfortunately, this isn't always as simple as it sounds. Some people live in multi-generational family homes, others in small spaces. Some may share housing for economic reasons. And on top of that, they may have an underlying condition or share with one or even more people who've tested positive for COVID-19 or are waiting for test results. But what this all comes down to is simply this. Many people living under one roof and not enough space increases the risk that COVID-19 will spread in that household, which means it can spread in the community too. This voluntary isolation site helps to reduce those risks. Establishing this site marks an important milestone. It's a critical part of our resurgence planning for fall and winter to limit virus spread and keep residents safer as we live with COVID-19. My team at Toronto Public Health will determine which clients may benefit from staying at the site as part of the COVID-19 case and contact investigation process. And eligible individuals will choose whether or not they want to accept the offer to stay at the facility. As you've heard, the creation of this site is a result of collective efforts by many at the municipal, provincial, and federal levels of government. Recognizing the need for a service like this in our community, we approach the federal government to partner with us. As you've heard, the Government of Canada is providing 100% of the funding for the operation of this site for the next 12 months. And I cannot thank them enough for their support for this important community initiative. Thanks as well to Public Health Ontario, who will oversee an evaluation of this innovative service for our community. And of course, thanks to my team at Toronto Public Health, who took this project from idea to reality in record time and who will manage the operations of the site on a go-forward basis. I would also like to acknowledge the constant support of Councillor Joe Cressy, our Board of Health Chair, and the members of the Board of Health. Without their support, this achievement would simply not have been possible. In closing, I especially want to thank all the people who will choose to stay at the site when it opens this weekend. Everyone who volunteers to stay is doing their part to help reduce virus spread in our city. This is an important act to help protect our residents and our city as we live with COVID-19. Everyone who helped create the site, those who staff it, and those who use this service show the kind of spirit we need to fight back against COVID-19. And there are no better words in reply than to simply say, thank you. With that, I'll now hand it back over to the Minister.
Thank you very much, Dr. de Villa and Mayor Tory, for working so hard with us. And I think we're ready to take questions now.
Okay, thanks everyone for joining us today. We will now open the floor to questions. As a reminder, it's one question, one follow-up. First up, we have Francine Copin from the Toronto Star. Go ahead, Francine.
Good morning, everyone. I wondered if you could tell us where this facility is. If you can't give us the address, maybe what part of the city it's in. Thank you.
So Francine, we will not be releasing the exact location of the facility. As I'm sure you can appreciate, we're talking about people who will be using the facility as they recuperate and recover from a COVID-19 infection. And we feel that it's best to protect their privacy. I think that's very important to them and to us in making sure that we're providing the best environment. So I will say that it is in a very good location in the city. I think it makes sense to where we are seeing higher risk in our city. And as well, I will say that it is a comfortable, safe, secure location. But beyond that, I won't go any further. Again, out of privacy and in order to ensure that we're providing the best security and confidentiality to patients.
Follow-up?
You can't say which part of the city, like northwest, northeast, south. I mean, it's a big city.
It is indeed. I'm going to decline to answer that specifically, but suffice it to say that it's well located and accessible to those who will need to use the service.
Okay, thank you.
Okay, thank you, Francine. Next up, we have Haley Cooper from News Talk 1010. Go ahead, Haley.
You can't say which part of the city, like northwest, northeast, south. I mean, it's a big city.
Haley, are you there?
It is indeed. I'm going to decline to answer that specifically.
Okay, I think we're having some audio issues, so we'll go up to Jeff Gray from the Globe and Mail. Jeff, go ahead.
Oh, hi. Yeah, I just wanted to ask sort of a technical question, I guess, about how it'll work for people, say, with children, or, if the child needs to self-isolate, the parent goes with them, or an elderly parent, or, will there be families staying, people who aren't testing positive but need to be there for caregiver reasons, or how will that work?
So that's an excellent question, Jeff. And that will reside, the exact decisions and how best to make use of the facility for those who are eligible for the service will rest with the case investigator. Each circumstance, each client's circumstance is unique and needs to be managed on its own merits and on its own specifics. So I think there are lots of opportunities for us to work with individual clients to understand what their unique circumstances are, to determine whether they're eligible for the service, and then figure out how best we deploy the service in aid of reducing virus spread in their household and therefore in the rest of the community.
Okay, thank you. I'll cede the floor.
Okay, next up we have Mark McAllister from City News. Go ahead, Mark.
Thank you very much. Very basic question to start. How many people will a facility like this hold? And how do you identify those people? How will the case investigators do so? Is there people already on a waiting list? How do you go about selecting who's going to be there?
So if I remember my details correctly, Mark, we've got a capacity for 140. That being said, who goes into the facility? Offers will be made to those who warrant the use of the facility. So we're talking about circumstances where, for example, we have a client who's COVID-19 positive and may live in circumstances where there are many people in the household where they're unable to effectively conduct self-isolation in their own homes. So we get those kinds of details through the very thorough case management process. That's part and parcel of our case management process, understanding what the circumstances are, who the household members are, what their home environment looks like, so that we can determine risk. Referrals will then be made, offers, I guess I should say, will be made to those individuals, and they can discuss whether they would like to make use of the service that's being offered to them in a way that makes sense for them and their family situation.
Follow up?
And should there, yes, and should there be an excess of 140 people that need to use a facility like this, what happens?
Well, I think, Mark, we're going to have to cross that bridge when we get there. We'd like to get the service up and running, make sure that we're able to provide a good service, which I have every confidence we'll be able to do. We'll monitor our numbers very carefully, and we'll have to take it from there.
Okay, thanks, Mark. Next up, we have Julianne from Radio Canada. Go ahead, Julianne.
Yes, hi, thank you very much. Merci. My question is for Minister Hajdu. So, Minister, you mentioned that this type of housing would be available in other cities across the country. So can you give us an idea of where this will be available as well? And are you planning to fund all these homes for 12 months as well?
Thank you for the question. Absolutely open to working with other cities that feel that they need this support. And we've been having those conversations with especially large city mayors since end of June. Of course, those conversations continue, and currently we don't have other facilities planned. But if a city requires that service, yes, we'll work with them to make sure that we can provide a similar support.
Okay, and my follow-up would be for Mayor Tory. I don't know if you're comfortable, Mayor Tory, to explain to us en français pourquoi c'est important d'avoir ce type de maison pour l'isolement volontaire.
C'est une initiative très importante parce que maintenant, nous avons beaucoup de citoyens qui habitent dans les circonstances avec beaucoup des autres, et c'est une difficulté pour isoler cette personne. Et cette initiative pour aider les personnes vivant dans les conditions de surpeuplement à lutter contre la propagation du virus et retrouver la santé rapidement.
Okay, thanks, Julianne. So last question will be Linda Ward from CBC. Go ahead, Linda.
Hi, good morning. I'm just wondering if you can explain just how long will patients stay in the facility, and what will happen should a patient want to leave after they enter the facility?
So that's an excellent question. So the notion of the facility is to provide a safe environment, a safe, secure, and comfortable environment for isolation to occur. And so the isolation period that any individual who is diagnosed with COVID-19 is required to undertake is a 14-day period. So that will be the period of isolation that occurs as well for these individuals. It's just a question of providing them an environment where they can actually effectively conduct that isolation. So, and if people do decide that they want to leave, again, it is a voluntary isolation site. But I think it's important to note that what we've done is try to create a comfortable, secure environment so that we can help people recover properly from COVID-19 and do so in a way that takes care of their family members and their entire community. So I think that's really what we're aiming for here, trying to create that environment, explain to the individuals who may benefit from the use of the service why it's good, and try to encourage them to participate for themselves, for their families, and for their community.
Thank you. And just as a follow-up, if you can just explain, I'm sure the people who will be in this facility will have some medical needs. How will the facility be staffed?
So we will make sure that it is well staffed. We have managed to secure the partnership of our colleagues at the Toronto Paramedic Services, and certainly each and every client who will make use of the facility will have regular contact with Toronto Public Health staff. That's part of our case management process, you know, in order to ensure that the recovery is proceeding well, that things are going well within the isolation facility. It's all around creating the conditions for success, and that's exactly what we aim to do with the clients of this isolation site.
Okay, that's it for today. Thank you, everyone. Have a great day.